Many people don't want to think about it, but suicide is an urgent issue here in Indiana. More than 1,000 Hoosiers have died by suicide every year since 2016. But what can friends and family do to help? Well, WRTV's Taj Simmons takes us to a class that could save lives.
The Franciscan Health Education Center makes it a goal to teach the public about health. But the conversation that I witnessed is a conversation that many people are afraid to have.
I see you. I acknowledge you. I'm asking about suicide.
Tina Hoffman is teaching this room to ask the hardest question if they see someone struggling, because the silent weight of mental stress leads some people down the road where they cannot return.
In the state of Indiana, the second leading cause of death is suicide for age 10 to 25. The more times we ask someone about suicide, it lowers their anxiety, it lowers that fear, and it opens up opportunity to have conversations.
If those conversations do not happen, dark thoughts can lead to deadly actions.
Maybe they're telling us about trauma.
And the people here are already afraid they will lose someone.
No one just wanders into a suicide prevention class. People come in that door because they're worried about their loved one. They're worried about someone else's loved one. They want to do better in their church. They recognize that somehow the ripple effect of suicide has come into their house.
Franciscan's prevention strategy is applied suicide intervention skills training, or ASSIST, ways to spot the risk factors in loved ones.
Think about like pregnant moms, because we recognize it's a lot of stress.
It might be stress you could understand with an honest, heartfelt talk before making an emergency call.
What happened in the 70s, how we talked about it, is they would just lock them up in a hospital, versus that now we're just trying to have conversation to keep you safe at home.
Suicide prevention that could require help from both professionals and personal relationships.
What would cause someone to think about suicide?
But you cannot help a crisis if you are not willing to talk about it.
We're breaking down barriers and taking away stigma by getting people comfortable to say, I see that you're hurting.
In Greenwood, Taj Simmons, WRTV.
Hoffman says she is ready to take her class on the road to any organization that wants to learn. If you or a loved one has thoughts of self-harm, you can call the National Suicide Hotline at 988 any day, anytime, day or night.